Good afternoon. My name is Alison Williams. I'm a research associate in the Department of Environmental Health here at the Harvard School of Public Health. It's my great pleasure to introduce today Governor Bill Richardson. Governor Richardson holds a BA from Tufts and an MA from Tufts Fletcher School of Law and Diplomacy. He has just completed his second term as Governor of New Mexico, after having been elected with the support of over 69% of voters. This represents the largest winning majority for any governor in state history. Governor Richardson's major accomplishments while in this role including expanding access to quality healthcare through the Ensure New Mexico initiatives, as well as making New Mexico the clean energy state and creating a green jobs cabinet. Prior to being elected governor, Governor Richardson enjoyed an extremely successful career in public service, academia, and the private sector, with an emphasis on protecting the rights and improving the quality of life of people both locally and globally. Governor Richardson served for 15 years in northern New Mexico, representing the 3rd Congressional District. He followed this with a stint as the U.S. Ambassador for the United Nations, before being unanimously confirmed by the Senate as the Secretary for the U.S. Department of Energy. While a congressman, Governor Richardson served as a special envoy on many sensitive international missions. He successfully won the release of hostages, American servicemen, and prisoners in a multitude of countries. For his humanitarian work, Governor Richardson has been nominated several times for the Nobel Peace Prize. Welcome, Governor Richardson.
Thank you.
Prior to the last few weeks, we were going to ask the governor to talk a lot about these international experiences. He made a mistake on ABC News, which I told him we couldn't let go. He was being interviewed about our response to Japan. And very broadly, and ABC News gave him about 14 seconds, he said that we really have to think about our policies for protecting health and safety, not only learning from Japan, but from the Gulf spill, from the mine disasters, for that. And of course, the beauty of national news is that was the end of the line he was given. So I thought that we would ask him to start with just some remarks about what this country and the world could do to think ahead about not having the kinds of health and safety risks. And this is a school that has incredible interest in that. Then we're going to open it up to questions from you about his decision-making in about every area of world and American life. And I think he's agreed to take your questions there. But I thought the energy issue and what faces this country and his experience with dealing with this was worth asking him to make some initial remarks about.
Well, thank you, and thank you for inviting me. Thank you for that introduction. It was perfect. Except you forgot one thing. I ran for president. And I like to tell people I had 2 problems in that run. Obama and Clinton. Other than that, I did fine. I always ended up being 3rd or 4th, mainly 4th. The lesson from Japan is there are several lessons. As you mentioned, in America, we really have to look at health and safety issues more carefully than we have as a country. Look what happened within the last year. An oil spill, the Horizon oil spill, damaging people, wildlife, health hazards everywhere. Mining disasters, 2 of them in South Dakota with our coal. Huge environmental and human disasters. Third, a pipeline bursting in California. We have a combination of aging infrastructure in many of our energy sources. And then lastly, although it didn't happen in America, this enormously devastating problem that existed in the nuclear power plant in Japan. So what are the lessons? First, we got to have a conversation in this country about the health, safety, and environmental risk of our energy sources. And it is going to probably take more funding. It's going to take debates about safety. Immediately with the Japanese experience, there has to be another debate on the cost and safety of nuclear power. Now, you got to be realistic. Nuclear power is 20% of the American source. We have 104 nuclear plants, including some in New England. We have 31 states that have nuclear plants. But it's clear that we have not developed sensible, one, evacuation plans in case there's a disaster. Secondly, what are the health hazards that might emanate from radiation, from a contamination? Do we have health plans, as the Harvard Public School Health Department devised a plan if there's one in New England? I don't know the answer, or Homeland Security Department. My sense is states, I know as a governor, we relied on the federal government to make this happen. I think we also have to have debates about the safety of nuclear power plants. Should we be building nuclear power plants in earthquake-prone areas, in seismic areas, seismic activity areas? What do we do about the technology in many of these plants? Almost a third of our plants have that Japanese technology that failed. Do we have a dialogue between utilities and the government, as Japan obviously did not, in making sure that there was adequate emergency response, that there was adequate safety plans for the residents of Japan? So I think those are the lessons learned. And am I going too long?
No, well, okay. A few more and then we'll open it up.
So that's my point, that I think it's important as decision makers, those of you that are engaged in healthcare, these are the most important issues facing any American, their personal worry, which is their health. And this is why your jobs and your studies here are so important. Americans will worry more about their health and their economic health than anything else, so you're in very crucial positions.
Why don't we, rather than have the governor go on in a long talk, we really want people to have a chance to question and really have an interchange. So why don't you raise your hands? We have a mic. Ask the governor a question, he'll respond, and then we'll move it around for this. You're free to take every international issue because he's been involved in huge negotiations around some of the most critical decisions that have been made. We need a hand here.
Hi, thank you for joining us today. I'm curious.
Just who you are so the governor knows.
My name is Shibata Hooley. I'm a pediatrician and an MPH candidate. Now, I'm very intrigued by the Clean Jobs program that you were describing in New Mexico. One thing that I feel like has been happening for the past decade in this country is we've been discussing the environment and we've been discussing the negative consequences for health effects and whatnot long term, but we've yet to been able to garner the political willpower to make some important countrywide changes. What are your thoughts about that? What do you think as private citizens can be done in order to kind of harness in on that?
Well, I'll try to relate my answer to decision making and leadership because that's what I understand you want. As a governor, and if you know New Mexico is an oil and gas state. We get revenue and a lot of benefits from that. We also have mining, uranium, coal, copper. And so I felt that it was important in my state, which is still one of the poorest in the country, to develop new industries. So we focused on three: bringing movies to the state, which has been very successful, bringing small high tech, and then bringing renewable energy. So what we tried to do is give those renewable energy companies, mainly solar and wind, tax incentives. We helped subsidize them. The state invested some of our capital in these companies. We gave them free state land. We basically said, we, New Mexico, want to be the clean energy state, to which the governor of California said, no, California is. Well, is that going to come out? Anyway, he's going to see it. So, there is this healthy competition. And even though Massachusetts, you guys have done okay on that. So that was the decision, was an economic one, that this would create a base of jobs for New Mexicans and technology for New Mexicans. And we had the advantage, of national labs being in the state, Los Alamos, Sandia, that are able to help the state with the technology to develop these companies. I think on a national basis, another message from the Fukushima disaster is the world needs to turn more towards renewable and natural gas and clean sources, especially Japan, which is 30% nuclear. You know, France is 80% nuclear. In Germany, it's over 50, but the German chancellor recently said, we're going to eliminate nuclear power. I think that's going to be very difficult. But I think one debate where you guys have not participated, not you, every one of you here, but the health component, is we got to reduce greenhouse gas emissions. But there's some health hazards if we don't. And that is not out there in the debate. It mainly is wildlife and clean air, but what does dirty air mean for kids? What is the effect of power plant pollution on people? And what are we doing to mitigate those? I think this is where the health component, health professionals need to participate more in that debate.
Up front.
Thank you, Governor. My name's Nayana Vitakuru, and I'm a physician from Australia and also an MPH candidate. My question relates to how you think multilateral institutions like the UN should interact with still the world superpower, the United States, and who should take leadership in tackling some of the major global issues of the day, whether it be aid, development, climate change, and so on. How should they interact?
We need more multinational, multilateral leadership in many of these international institutions, and many times they are hampered by nation states that don't give the international institutions the budgets they need. For instance, when I was UN ambassador, the World Health Organization was always fighting for dollars, and countries were always late giving it dollars. Yet it does very important work. I think, for instance, in South Africa, and your dean is talking to the Minister of Health in South Africa. South Africa made some wrong decisions on AIDS, yet international institutions were the ones that pointed out the problem in the South African approach to AIDS, which had been minimized in the last South African government. I think multilateral institutions are critically important, especially in the third world. If you look at the UN, it's really an institution dominated by 5 countries: U.S., Japan, U.S., France, Britain, China, and Russia, the 5 permanent members. But there are hundreds of nations in the third world, Africa and Latin America, that need representation, and these institutions that deal with health, that deal with issues relating to diseases and AIDS and malnutrition, you need that international leadership. Now, I'm just going to, decision-making wise, it's better when you push a policy to have other nations and other entities support you than doing it alone. So if there's a worldwide AIDS initiative and Australia is leading it, Australia needs the support of the international community. The more countries, the more entities help, the more effective your policy is. Are you a native Aborigine?
No, my background's Indian.
That's great.
I migrated to Australia.
You know, that's another issue. The indigenous people of the world, they don't have representation. At the UN, I mean, you're talking about Native Americans, not just in the United States, but in Latin America, in many parts of the world. They need that representation. They need a voice, and usually international institutions and the UN can do that.
Thank you. My name is Michael Olugbili. I'm a doctor from Nigeria. Sir, you clearly pointed out New Mexico is one of the states in the U.S. that has oil, but it's one of the poorest states in the U.S. And from Nigeria, we have crude oil. And recently, Ghana, one of our neighboring country, they discovered oil there. And the fear that people have is oil, having the natural resources, is it a blessing or a curse? So I want to know what will you be your advice as a future president of Nigeria? How can we turn natural resources to blessings?
You know, the two biggest countries in Africa, when I was at the UN, one of the advocacies that I had was there should be a permanent member from Africa. And South Africa would say, well, it should be us, Mandela. And then Nigeria would say, no, it should be us because we have the oil. I mean, these are two great nations, huge nations. And there's a rivalry, but Nigeria is a fascinating country with enormous energy resources. And the young man is saying, is it a blessing or a curse? Right now it's both, because there's too much dependence on that fossil fuel. And the curse is that in the Niger Delta, where a lot of this oil is produced, the residents of that Niger Delta, the poor people, are not getting the benefits of the energy source. It's all the benefits are going to the capital, to Lagos and Abuja. Yeah. So what I would advise, and I have, you remember Obasanjo? Yeah. And there's an election in April. Is Goodluck going to win? Is it Goodluck? Yeah. Good luck. So the issue is going to be, and I think Goodluck wants to do this, although I don't know how that election will turn out, is reform the Niger Delta so the local people that produce the oil get more benefits. And this is a parliamentary political issue. It's not a health issue, it's politics. Where is the power? And then secondly, I would advise, just like in my state and in many states like California, they have a lot of oil and gas in California. I bet you didn't know, but they do. They should, and they have been developing more renewable sources to diversify their background. You know, one thing that I want to say to you, and you're mainly practitioners, you're good people, you cure people. I know you probably say, oh, politician, you know, they just want to get votes out of this. I'm going to tell you, if you're in politics and government, you got to be comfortable with power. I like power, but to do the right thing. I'd rather have the power to build a rural health clinic. I bet you I can build a rural health clinic faster than any of you can. and I don't mean that in a critical way to you, but be comfortable that if you have the ability, if you're a minister of health, and many of you could become that, or run a hospital, that the power that you have to make a decision affecting people, be comfortable using it. Don't shy away from it. Don't say, oh, I want to bring everybody in. Let's call the whole city of Boston. Just make the decision. Get some factual basis behind it. Build a coalition of support, but don't be afraid of power.
My name is Susanna Ramirez, and I'm a postdoc at the National Cancer Institute and getting my MPH here. My question is, I'd like to ask you to reflect a little on a decision that you had to make where, recognizing that you're a politician and you can't always do the ideal thing,
right.
Where you had to make compromises, and what did that look like in your mind, and ultimately how satisfied were you with that?
Well, look, I wish I could find one decision that I could give you an example. All right, I will. I always had been for the death penalty. I always felt that it was a deterrence. that if somebody committed the most egregious of crime, killing a child or, just some of the horrific crimes that exist, that deserved the death penalty. And so I had that position as a congressman when I ran for president. It didn't help me in Iowa, by the way. I was about the only one. But then I had a direct decision to make on some death row people as governor, and it was my last year. And I read a lot, reflecting what the data had been, whether I read a lot in cases where juries and the legal system had thrown out death penalty cases because of very skimpy evidence, bad representation, bad DNA. In other words, faulty death penalty decisions. And I said, geez, who's compiling this? And I found that in many cases, the state, the government, is not able to do this right. And then I looked at the world and I said, who are the death penalty states? I was informed. I didn't know this issue well. I kind of put it behind me saying, look, I'm for the death penalty. Then when I was faced with it, and I found that the only countries with a death penalty were countries like North Korea, Iran, some of the bad guys. I said, we're in that company. And so just in my own way, I felt, well, I'm going to reassess this issue. And in New Mexico, the decision was not to just get rid of the death penalty. It was, all right, in lieu of the death penalty, life imprisonment without parole. And so I then went to some of our jails, and I saw our jails. And I said, I know death is bad, but life imprisonment in this jail is just as bad. So, like the last day, I came to a decision to sign the bill that repealed the death penalty. And it was not popular, poll-wise in my state. New Mexico's western states are more conservative than you guys. Here in Boston, there's about an 80-20 on the death against the death penalty, and probably every one of you. Well, I don't know. I won't speak for you. But in the West, it's a different culture. Guns is another issue. Hunting is sometimes cultural issue. But that's how I made that decision. Now, look, I'm a politician. I did end up with 69% of the vote. And so there were some decisions that I made that I knew we all polled. We all ask scientific and political people to say, well, does the School of Public Health at Harvard like immunizations or not? Well, the answer is probably 90% yes. But we ask questions like that, and many times we're guided, and some politicians do. I tried as much as I could when I made a decision to get all the facts, get my people in a room, my policy people and my political people in the same room, let them hash it out, and then I'd make the decision, and I'd stick by it. I wouldn't change it. I said, now, everybody here has to follow this decision, even if you didn't agree. If you didn't agree and I hear you popping off, you're gone. And I did that a couple of times. But you've got to build that consensus within the population before you make a major decision. And on the death penalty, I was kind of preparing people. Well, maybe the governor's changing his mind. And I'd kind of leaked that out. And then I said, I want every New Mexican to let me know what they think. And so we had a website, and it was about 60-40 that I should keep the death penalty. And so politicians sometimes make conscious decisions. We're not that bad.
Hi, my name is Anshu Abbott, and I am a medical student from San Diego, and I'm from Pasadena, where you were born.
I was born there.
Yeah. And I'm an MPH candidate as well. And my question is how you set priorities in decision making, especially in the context of your political life. So as you were planning to run for president, as you're running for president, as you're governor of New Mexico, how do you prioritize international issues, local issues, other, local issues around your state, immigration in Arizona? How do you view those issues, and how do you prioritize what you take a stand on and what you don't?
Well, if you're a good public servant with my state, the biggest issues were one of the poorest states, a lack of an economic base, lack of health care, especially the Native Americans in my state, mainly Navajo, had no access, and the Indian Health Service was supposed to take care of it, and they weren't. The state of our schools, we always ranked low in terms of testing, and so education, healthcare, and developing new sources of income, mainly in the energy area, were my three big priorities. And I ran on that, and I said I would change that. At the time, there was gridlock in my state. The governor and the legislature hated each other. The governor would veto everything. We had a very interesting guy. He was a libertarian, and he didn't believe in spending on anything. So he'd veto every bill. He left me a great surplus, by the way. But his big issue that hurt, well, I don't know if it hurt him, because I think his big thing was legalizing marijuana. That's what he wanted to do. And he may be ahead of his time on that one. I'm not for that, but there's some now arguments with the war on drugs not exactly working well. When I was running for president, and this is the mistake that not that I made, but that I thought the American people, when I was running, would like somebody with international experience, with being a governor. Actually, there never been a senator elected, except for John F. Kennedy and a couple others. So I thought being a governor, you had Reagan, Bush, Clinton, is like people like hands-on. And I thought the international side would be helpful, running a state. And I thought like a good resume would be an asset. The American people wanted inspiration. They wanted, they wanted an Obama. And I realized that. I was sitting with my wife in one of those debates. I don't know, did you see them? I mean, these are tortuous events. If no one asks you questions, they're like it was always Obama and Clinton to the rest of us in the back. But I remember, and I ended up endorsing Obama, but I remember one of the debates that we had, and my wife was right next to me. And Obama gave, I think it was in Cedar Rapids, early on, he gave this very eloquent, inspirational speech. And I remember turning to her and saying, this race is all over. This guy, I may vote for him right now. So, that's how I arrived at what I wanted to do. And so, those are decisions that you make based on your experience, you poll. But if you just do it on the basis of data and not your gut instinct, if you're in politics, you won't always get ahead. Another piece of advice that I have to anybody, I'm here at the Kennedy School for 5 days, is young people say, what advice do you have for me? I want to get into government. I say, run for office. Don't be part of a campaign, run yourself. But I'm a businessman, I'm a health professional, doesn't matter, run. We have we should have more doctors and health people in government. It's mainly lawyers. Know at least the issues that affect your community and your profession.
My name is Eunmi Kim. I'm from South Korea. Currently, we are dealing with a very difficult situation because of North Korea. And the current government created this huge political tension. And the private sectors, I'm a pharmacist and working as a volunteer for Pharmacist Association, and it was very difficult for us to even provide medical aid in private sector. So how would you say to our politicians to deal with these people in need, because we want to provide medical aid for North Korean?
Okay, I heard the last part. You said, how can we provide medical aid to North Korea?
Under this political tension.
Yeah, okay. Yeah, good question. I've been to North Korea several times. I'm one of the few Americans that the North Koreans invite. In fact, President Clinton used to say that the reason I'd go to Iraq and Sudan and other places is because bad people liked me. And in North Korea, there's a very, as you know, there's a very unpredictable, violators of human rights, isolated country. But their people, I believe, as you know, are suffering from malnutrition. There's no jobs, there's hunger. And so one area that has not been part of sanctions has been medical assistance from international agencies, Doctors Without Borders, the UN system. However, the North Korean government has played politics with that aid, basically pushing out international agencies and saying, we'll distribute the food. And it's caused some increased hardship there because many times the government puts that food out on a political basis. But I think the key to making things better, this goes into another political issue, is I believe you got to talk to your adversary. I believe not talking to North Korea, not talking to countries we disagree with. The embargo against Cuba makes no sense. That we should engage, and doesn't mean you cave into their position. But because of the humanitarian situation, because of the fact that North Korea has 5 nuclear weapons, maybe more, 1.5 million men in arms, they got missiles, we've got 28,000 American troops. So that's our interest there. Now that whole area, we've got a lot of allies, South Korea, Japan, that it's important to engage them, and continuing to isolate them sometimes is justified, but eventually it's the people that suffer, that are not political. They're not getting food. And South Korea has been very good, the government, regardless of what political party in South Korea, in assisting with humanitarian aid, family reunification. I think the key to a new North Korea will be South Korea and participating, because the contrast is huge. South Korea is dynamic, they've got jobs, they're creative, great schools, great students. North Korea is, isolated. It's a socialist state that is stagnant.
Thank you. My name's Greg Keane. I'm a psychiatrist and a Master of Public Health candidate from Australia as well.
I love the way the Brits talk, don't you?
Australia.
I know, but the same. I love the way. I love the way you guys talk. Are you Hugh Jackman? No?
That's the nicest thing anyone's ever said to me. Governor, I really learnt a lot from your description of your approach to the death penalty. One of the other sort of really important but very emotive debates in this country is about border protection and immigration. And I think it's something that I'd really like to hear. I'd like to hear about from your perspective. One of the topics we've talked about a lot this year amongst the students is the DREAM Act and its failure through the Senate, especially in December. And I'm wondering what role as leaders we can play in enabling a dialogue on that act, which doesn't engender, worsening racism debates, and how we can have an effective debate which enables us to move forward in a very human way, I think.
Yeah. I love this guy. I'm going to call you Russell Crowe. All right, I'll stop doing that. I'm the wrong guy to talk to on the immigration issue because my position is probably one of the most divisive and unpopular in the country if you poll what I say, what I'm for. But I'm also a border governor, and I'm one of the I was one of the 4 border governors. And in New Mexico, if you look at our record, and we have some New Mexicans here, we didn't have the turmoil that Arizona or California and Texas has had. So here's my approach to the issue. And I had a debate at Yale yesterday. I guess I shouldn't mention Yale in front of you people. And they got a good public health operation. They got school of nursing, they got public health, hospital. It's a lot of health care there. This is my view. And I came to this position. You cannot separate who you are. My mother's Mexican. I was raised in Mexico. My mother would only speak to me in Spanish. My father, he'd never speak to me. No, I'm just kidding. He'd speak to me in English. He was very harsh. He was a tough guy. So I feel as a Hispanic American, you're part of this debate. You can't okay, well, I'm not going to take a position on this because I'm affected. I've always felt it's important to have international relationships. The relationship with Mexico, to me, has been very important and neglected in U.S. policy. The relationship between the state of New Mexico and the state of Chihuahua, which is our neighbor, I really worked on it. I think it's very important. So I think the way you deal with immigration is 3 ways. One, yes, we have to have more border protection. There's no question about it. Drugs are coming in. Violence is coming in. There's an illegal flow also. But I don't think you find a way to say the answer is to create a fence, build a big fence. You have a 14-foot fence. My Harvard advisors, they've heard this about 80 times. You know what's going to happen with 14-foot fences? 16-foot ladders. And it doesn't work. But we do need more boots in the ground at the border. We do need more detection facilities. We do need more National Guard, Border Patrol. I mean, look, we're a nation of laws. And Mexico needs to do more to give jobs to their own people, which, that would be a nice thing to do. So that has to happen, I believe. But where I part with others and in the American political debate is, what do you do with the 12 million that are here? Some probably in this hospital, right? 12 million. Doesn't make sense to deport them. That's going to cost $200 billion. What are you going to find them? We put them in Fenway Park, and it just doesn't make any sense. So what you do is integrate them by not saying, okay, you're now an automatic citizen. You came here illegally. We're going to make you a citizen. No, you don't do that. But you say, all right, over a period of time, if you satisfy the following conditions, you pay back taxes, you pass a background check, you get behind those that are trying to get here legally, you learn English, you embrace American values. Are these tough conditions? Not really. But are they going to be hard to implement? Absolutely. In fact, it may be a mess. I think if you put those forward and say, okay, at the end of the line, you can be legalized and you can stay here. And then the last thing that I did in the state on the DREAM Act, I did it 6 years ago in the state. It's happened there because it makes sense, I think, through education. As long as, and you're talking about some undocumented workers that are in the American military, yet they can't, they can't even get a green card. That's absurd. Well, in my state, they're eligible for scholarships if they satisfy the same academic standards as anybody else. So the DREAM Act. But what I did that was most controversial was we pushed a law 7 years ago that gave driver's licenses to these illegal workers. Why? Well, you know why? Because my, am I talking too long?
Keep going, we're fine.
Okay. My director of security said, Governor, do this because it enhances the safety of our people. And so we did three things. We said there's got to be strong ID papers for these individuals. But the results were, one, we got more motorists that insured themselves. Secondly, traffic safety improved. And if you want to be perverse, you know where they are because they give you their addresses. And so 3 states have done it. And so, but my approach here, the license is very unpopular in this country. But I think it's the way you deal with it is you integrate people. I mean, most of these individuals, they want a better job for their families. They just want a better life. They're not criminals. Now, passing a background check, I think, is important because you don't want somebody with ties to nefarious characters and drug lords, etc.
Question.
Good afternoon, Governor Richardson. My name is Victoria Macias. I'm an epidemiology student here at the School of Public Health. So in New Mexico, we have a particularly high prevalence of obesity-related chronic diseases in the Hispanic and the Native American populations. So what I want to know is what advice do you have, or what characteristics do you think that a public health professional should have to communicate better nutrition and physical activity? As we, I think, both know, many foods that are staples in the Native American and Hispanic population are refined grains and meats that are high in saturated fat. How do you communicate, or how would you communicate better nutritional standards without insulting a culture and keeping that cultural sensitivity?
Yeah. The first step, one of the things I did do, which was a plus, was I got rid of junk food in schools. In other words, I took on Pepsi and Coca-Cola. They hate me, by the way. They see I don't have a Coke or Pepsi. So I said, look, we're just not going to have it. And it was a huge fight, huge lobby. But we won. Didn't succeed entirely because they were able to keep the, in the schools, what do you call those machines? Yeah, I mean, there was a little, and then I noticed a few, I guess, loopholes. But we did generally get, I think that's the first thing for all kids. I should have done more in that area. I just feel that a lot of it is education. It should come from parents, from schools. I mean, there's always this view the government should do it, and they're the best ones to do it. Well, that's not entirely the case. I think if we find a better way of communicating this, and another theory that I have is traditional media, TV ads, the Native Americans. I used to have, whenever I ran in the Navajo areas, I'd get a Navajo elder talking about Bill Richardson in Navajo, Bill Richardson. Then I knew it was okay. That's supposed to be funny. What's wrong with you people? But then I found out that the Navajos don't listen to, well, most of them, they don't listen to their own radio. They're mainstream. It's like Hispanics. Everyone thinks that Hispanics, if you put an ad on Univision, that they're going to listen to it. They watch, maybe they do, but they watch CBS. And then the second fallacy is I think this technological revolution, I think there's a way maybe we can penetrate young people through Facebook, the internet, through Twitter, through this new technology that all of you are so good at that we're not doing. There's my Native American friend from Santo Domingo. How can we talk about that issue with Native American populations, the diabetes issue? What should we do?
Seriously, share the mic.
I think one of the biggest fallacy in terms of culture is that within communities there are like very progressive people and very traditional people, and so to sort of say like we need to have cultural competency, it's sort of like a mixed bag, because like cultural competency into what area? Like, do you sort of like cater to the traditional people or to the progressive people? I know one sort of interesting phenomena in my community right now is the fact that Zumba has caught on so well amongst both the young and older women in my community, and people talk about it on Facebook and on MySpace, and it's very interesting to see like like what sort of things are happening. Like people are buying shirts, and it seems to like continue to expand to even like like. So who would have thought that like something that was like sort of non-traditional or like sort of like mainstream would have like penetrated into Native American reservations? I think you're right in sort of discussing like how we can engage the media, and
we did the traditional thing, but I don't know if it worked that well. We did some ads, the health department. I remember they were not that good, the ads, and so we did the traditional thing. I think we got to do different, and not just minority kids, but all kids about nutrition and the way the communication. Look what's happened in the Middle East. This is a technological revolution of all protesters finding ways to talk to each other. Look, this worked in Tunisia, so do it in Egypt. Look, that's what they did. And so somehow the older folks, the older politicians, like me and others, need to catch on to that. Find a way to communicate better through these new methods of communication.
I'm Ricky Gonzalez. I'm a PhD student here, and I'm also from New Mexico, so I have a very local-based interest in your response to this. So in kind of thinking about the response to the health reform law last year, since then we've seen a lot of governors being out front in their criticism of the law and challenging it in court. But what we haven't seen as much is leaders from states like New Mexico who probably supported the law, even if they had some reservations, really advocating for it so it can be implemented successfully. So I was wondering how you decided to approach the passing of the law in the last year of your governorship.
For 8 years, well, 7 of the 8 years I tried to pass a health care reform law, and I couldn't do it. I just couldn't do it. Too many special interests. Now, I don't know how you guys feel about this, but everybody in the health, and I know I'm being recorded, so I'm going to be more gentle but doctors, nurses, hospitals, HMOs, they all have their little deals, and they don't want anyone to mess with them. That got me in trouble, but what the heck. I just think that there's got to be advocates for the common good, the patient, that have not surfaced, and maybe health professionals like you can be more a part of this debate. So, look, universal health care. I was supportive of the Obama health care plan, and I said so. I signed letters. I wasn't terribly vocal. I'll be honest with you. I was at the president's, this was his second year, and I was, let's say, entering my last year in government, and he was pushing the health care bill. And there were 50 governors there, the only governors and the president. And the president said, what about the health care bill? What do you all think? And everybody was, let's do it, and which includes me. I didn't say anything. But then I said to him, I got up and I said, Mr. President, I think that you're going at this the wrong way. I think what the American people want is jobs, the economy. And you should do health care after you have a jobs plan. I don't think he liked what I said. So I've got to tell you that I felt that the timing should have been secondary, while health care is important, to the state of the economy and to people, just the anxiety of an economy in bad shape and jobs. And so this is why I wasn't hugely vocal, but I supported the law. On the whole, for New Mexico, it's good because it as you know, it insures more people. And it's got, the single payer debate. Oh, why didn't we do single payer? I think there's some merit to that. I'm just wondering whether you want the entire healthcare system run by the government. But then you say, well, the private sector should do it. Another, and my last point on healthcare, because one of the things I tried to do is mental health. That's been a big interest of mine. Because if you look at this country, the priorities, mental health has had a really low priority. Substance abuse, mental health, they don't get all the insurance. And so, I don't mean who's the cancer question? Was that you? I mean, there's big priority cancer as it should be, not enough resources, but then when it comes to mental health, schizophrenia, it's a lesser priority. So what I try to do is, I had all these agencies in state government interested in mental health. They all had a little piece of it. And I said, well, who's handling the problem in Espanola that deals with cocaine and deaths there? About 5 agencies. Oh, we do that. No, they don't do it. We do it. And so I said, this is this is crazy. We're going to get one entity to do all mental health. And we'll have a czar so that I can follow this, because this was a big problem. Again, take control. Don't be afraid of power. Find ways to shake up bureaucracies. I mean, this is something that I try to do. And so what we did was we put it under one entity and one collaborative, one partnership. I hate these words, collaborative, partnership, but I guess we all use them. And what happened next was the 2 collaboratives that we picked to run mental health had huge problems. And so you say to yourself, well, you try to synthesize, compartmentalize, bring things closer. And it didn't work as well as I thought. I still think it's better. Ricky, are you mental health specialist? Not specialist. Anybody in mental health? Okay. New Mexico was the only state that did this, put this under one roof, all agencies. Does it make sense to do that, or what would you do?
I think integration is useful.
We have to record you.
I think it's important to integrate mental health within primary care, so that when people present, they can get immediate access to mental health, and I think that we have a lack of that. In terms of managing mental health care overall, I think that as a psychiatrist, I'd say fantastic if we've got linkages to the governor and we've got a voice there. That's fantastic.
Yeah.
In terms of advocacy for people with mental illness, and they're an underheard minority.
Okay.
We have time for one last question.
And then, can I have a closing statement?
Yes, absolutely.
Thank you. So, Governor, you're obviously well versed on a huge number of issues. So, what's next for you? Is there some issue that's particularly important to you at the moment? Is it environmental health in the aftermath of the disaster in Japan, or sort of just what's next on your agenda and what issues are particularly important to you at the moment?
Well, thank you. I'm basically doing 4 things. We all go through this in our lives. Every one of you here. I know in health, this is a very intense profession. You got to study hard. You got to get out there with people. You're like in the same business as I am. People react to you, what you did. You've got to make decisions. For me, this is the first time that I've been out of public service. I'm basically a private citizen now. But I find myself at the same time telling my wife and my family, well, we're going to spend some time together. We're going to relax and travel. I said, I'm going to go to all the major league parks that I'm a baseball fan, that I never saw when I was doing all this 20 hours a day. I haven't been to one. So I'm doing three things. One, I'm giving speeches where I get paid pretty well. So my boring speeches, I now get paid. Not to you. You guys are for free.
No, I can assure you about that.
So that's one part of my life. And, you know, where are you? I hire, I'm part of a speech bureau, and they promote you. And, you know, it's conventions, wine and spirits. You probably wouldn't approve of. And so I do that, and I've done several of those, and they're here and in Europe. Then I affiliated with a communications company called APCO, where I advise companies mainly that have problems overseas. Decent problems. Don't think they're bad problems, but that's the second. The third is I'm on several nonprofit and for-profit boards, a couple environmental boards, a couple of solar energy companies where you're on their board of directors, you attend meetings, and you get paid. I'm trying to build a little capital in my life. And then the last thing that I'm very excited about is a foreign policy center that I'm starting in Santa Fe that will do three things. One, will deal with hostage rescues. No one's asked me about a hostage rescue. Secondly, that'll deal with like the bad guys of the world, the North Koreas, the Sudans. Yeah, how do we deal with them? And then third, Latin America, which is a particular interest of mine, which I don't think gets enough attention. So it's a little center. It's not a Jimmy Carter Center like you have here at the School of Public Health. So that's what I'm doing.
Why don't we give the governor a chance just for a second to have some closing remarks, because everything else was directed from us.
Well, I'll simply say I find this contact with you very good for me, because I learn what's on your mind. My my advice to the students that I've talked to this week, that I talked to at Yale, and you're in a little bit of a different category because you're more specialized in healthcare, is one, there's about 6. I'll probably do 8. I got to refine this chat. One is be conscious of your government. What your government does affects every one of you. And to say, well, this is political, I'm not going to get into that. I'm a doctor, I'm a health professional. Be conscious of the political side of decisions that affect you. Secondly, I think it's very important, as I said, not to be uncomfortable with power. Find ways that you use that power wisely, but don't think that it's necessarily a bad thing, so be comfortable with that. The third thing that I tell students, and probably less so in your profession because of your upward mobility, is it's not so bad to run for office. Getting elected is not so bad. Serving in your community, serving in county commission, city council, planning commission, or eventually something else. Especially women. Women, I find, run for office less. Statistically, I don't know what the reason is, but I would urge women not to cede that political role model of being a candidate. I think President Obama has shown that this country will elect an African American. I've seen Asian Americans. I was with a young man in Yale who said, well, I need to find an Asian American district in California. I said, well, no, run in where you are. It's what you project. It's not your ethnicity. That's a factor, but I think the American people are moving very much in a different direction. And lastly, on decision making, how do you make the right decision? And I can't put myself in your shoes because many of yours are medical and scientific. But in a political person's view is one, you want to have and build a broad base of support. Give others credit. Bring different people in. You know, I've always found that when I made the toughest decisions, bring into the room the people that you know hate you the most, that oppose you the most. You know, when I made the death penalty decision, I brought in a lot of cops, you know, families of people that their kids had been killed. And I'm not saying it was a political gesture. It's a way to enhance your ability to make a decision, but also to get another point of view. Don't be afraid of opposition. Recognize that how the public perceives what you did is very important. So doing a decision in the heat of night, just yourself, even though it's the right decision, don't do that. Something else, if you make a mistake, if you screw up on something, academic, get it out right away. Admit it. Well, don't overdo it. And then when you're making a decision, don't always have people around you that love you and say you're great, and don't have a couple of people that say, Governor, this is not the right thing to do. In fact, it's the dumbest thing. I mean, after I socked that person, it's still in there. Nobody likes to hear bad news, but be prepared to hear that bad news and to get that point of view that maybe you haven't heard because you're so determined to do that. And then the last thing is I believe that that America and this institution, I think you're in a good country. And in the end, what you do in your profession affects probably more people than I do. The last thing is your director here, Julio Frank, he's a Mexican. He's a Hispanic, like me. Well, he's this Mexican. He was Minister of Health. He did something that every nation has wanted to do. He had universal health care in Mexico under his watch. It was called Seguro Popular, right?
Yes.
Where every Mexican got health care by the year 2011. You know, we haven't come close to that. And I said, how did you do this, Frank? You're a scholar. You talked the president into it. And I said, well, did you just do an executive order? He said, no. I wanted to go to the Congress so that it stays there forever. He just said that to me. And that was a great accomplishment. And now he's your dean, and you know, he was asking me about the Hispanic community in the U.S. He's very good. You're at a very good school. You know, that Harvard degree is very important. It's an asset if you want to run for office, by the way. Don't think it isn't. Anyway.
Governor left
thank
me
you.
in an uncomfortable position. I want to say this was absolutely terrific, but he said I have to be careful. It was terrific. We are extraordinarily grateful that you shared this with us.
Thank you.
Thank you very, very much for coming.